Hi, I'm Dr. Jeffrey Albaugh, and I'm an advanced practice urology clinical nurse specialist. I run the sexual health clinic at both the Jesse Brown VA Medical Center and at North Shore Urology at Glenbrook Hospital. Sex after prostate cancer treatment can be deeply satisfying, but is often different than it was before treatment. This video will deal with different aspects of intimacy for men with partners after prostate cancer treatment. Although sex and intimacy are very closely related, they are two separate, distinct concepts. While sex has to do with the act of sexual relations, intimacy has more to do with communication on many levels in a deeper and more profound way. Sexual issues can impact sex, intimacy, and even affection between a couple following treatment for prostate cancer. Now, after treatment for prostate cancer, recovery from erectile dysfunction generally happens slowly over an average of 2 years. Try to be patient. In fact, some studies have reported that it can take up to 4 years for men to see the most improvement in their sexual function after surgery for prostate cancer. Many men continue to be affectionate with their partners, have intimacy, and sex. The way you relate to your partner in terms of physical affection, such as holding hands, kissing, putting your arm around your partner, can be impacted after treatment. Both men and their partners sometimes become insecure with any way of physically relating to their partner because they're concerned that it may send the wrong signal that they're wanting sex. Men are fearful they will send the wrong signal to their partner, while their partner is afraid that any physical contact might put sexual pressure on the partner. With good communication, physical touch and affection can be very comforting for both a man and his partner during the time after treatment. So I encourage both men and their partners to continue to be very affectionate with each other. Communicate about any concerns or feelings with your partner. Sexual activity can include genital stimulation of various kinds. A man does not have to have an erection to bring his partner to climax or even to climax himself. Almost all men with erectile dysfunction are still able to climax with the sensation of orgasm, even though fluid does not generally come out of the penis after prostate surgery, since that fluid was produced or went through the prostate. The majority of men in one research study reported that although orgasms were different, they were as good or better than before the prostatectomy. Men who have never had erectile dysfunction are often surprised that they are able to climax without the erection. You and your partner have many things to discuss, and it's very important that you sit down and talk about it. And talk about it when you are ready and when you're able to do that. When you want to be sexual and in what ways you want to be sexual are discussions you're going to want to have with your partner. There are many enjoyable options, and you both already know things are different now, and there are issues with erections after treatment, so enjoy the sexual journey together. Some sexual things may change after treatment. Some men may fear they won't be able to get an erection or feel like a failure if they can't perform. Erectile dysfunction, even if temporary, can be a big blow to some men's sense of manhood. Worry and stress only add to the problem. Some men may have fears about leaking urine during sex. Now, this can happen sometimes, but it's harmless since urine is sterile anyway. Men and their partners may be fearful of pain or discomfort during lovemaking, which can be another distraction. It may take some experimentation to find what works best for both you and your partner. Remember, sex is supposed to be fun, so explore and enjoy each other during this time of rediscovering new ways of pleasuring each other. It may help to approach sex after prostate cancer without any expectations. If you're prepared for these changes, they will be less surprising. Knowledge is empowering for both you and your partner. No one knows definitively who will and who will not experience continuing sexual issues after prostate cancer treatment. Putting pressure on yourself to perform sexually can make sex stressful and frustrating for both you and your partner. Keeping the lines of communication open, including discussions about what's working and what isn't, is also important. If you don't experience the results you hoped for right away when you have sex after prostate cancer treatment, try not to be discouraged, because it can take a few years to recover fully. In the meantime, you and your partner can be sexual in many other ways, and this can be very gratifying in terms of intimacy and sex. Men who have dealt with prostate cancer have to learn that sex is a whole body experience and is not just about the genitalia. They have to concentrate on finding the parts of their body that are sensitive to touch. We have over 100 billion nerve cells in our brain, as well as nerve endings all over our bodies. In just 1 square inch of our hands, there are over 9,000 nerve endings. The brain is a big part of sex, as is touching. Explore and find out what you enjoy in terms of touch and intimacy with your partner. Remember, you can still have a climax sensation, and so can your partner without the erections. Sensate focus is planned love play that does not put the focus on bringing your partner to orgasm, but rather focuses on teaching each other what kind of touch or kissing feels good. You are the perfect guide to your own body, and no one else knows better than you what feels good. You can do this completely undressed, partially clothed, in the bathtub, or in the shower. Be creative and enjoy the sensations while you teach your partner what brings you pleasure. One new way may be enticing each other by mutual masturbation or self-stimulation. Holding each other and self-pleasuring can be exciting. Manual and oral stimulation may also be enjoyable. Part of the purpose of this is to get in touch with being intimate and not putting pressure on the man to perform. We are all responsible for our own orgasms. There's many sensual, intimate things that couples can do together. If they are both comfortable with it, a couple can watch sexual videos together or read erotic literature together. There are a variety of sexually explicit video and books that appeal to both men and women today, but everybody's different in their tastes. Showers are a fun place to play around. Often couples are less inhibited in water, and you may not be as worried about urinary leakage in the shower either. You can bring a small stool into the shower so you're more comfortable and perhaps enhance being playful in the water. There's also fantasy. You can discuss fantasy with your partner and decide if you want to role play any part of your fantasies. You can start the conversation by talking about the dreams you've had and how you can incorporate those fantasies and dreams into your sex life. Regardless of what disease you're talking about, diseases make you realign, reassign, and redefine your sex life. Even though it's not what it used to be, it still can be exciting, romantic, and stimulating. The new experiences may be different, but they can still be good. While there are definitely challenges associated with sex and prostate cancer, many of them can be overcome with patience, persistence, and perseverance. I do realize, however, that you might need time. You need to take the time to grieve what you've lost and the changes that you've experienced with your body. That can be necessary and healthy. I would like to thank you for your time and attention. I hope this information has been very helpful to you and your partner.